Hi, everybody. Thank you for your patience tonight as we get started. Pleased to introduce Dr. Lyndsey Nalu, coming to us this evening from Sarasota, Florida. Without further ado, Lyndsey, go ahead and get started. Thank you so much.
Absolutely. Thank you so much for having me this evening. I'm happy to be able to present to you all on untreated hearing loss, the effects on physical, cognitive, and social well-being. To give you a little bit of background on myself, I am an audiologist and the owner of a private practice located in Sarasota, Florida. It's called Adept Audiology. I received my doctoral degree from Central Michigan University and have conducted extensive research in the areas of audiologic counseling and oral rehabilitation. I'm licensed by the Florida Board of Audiology, and I am a fellow of the American Academy of Audiology and the American Speech, Language, and Hearing Association. In addition, I am a board member of the Hearing Loss Association of America, Sarasota chapter. To give you an overview on what I'm going to be speaking on, I'm going to start by talking about some of the numbers on untreated hearing loss. I'm then going to go over why hearing loss is often left untreated and the effects it has on your physical, mental, and social well-being. I'm going to end with discussing what you can do to avoid putting yourself at risk. So who has hearing loss? Approximately 48 million Americans have some degree of loss. We know that around a third of the Americans between the ages of 65 and 74 have hearing loss, and nearly half of those over the age of 75 have some degree of hearing loss. Hearing loss is considered the third most prevalent chronic health condition facing older adults today. So who has untreated loss? Believe it or not, only 20% of the individuals who might benefit from treatment actually seek help. That means almost 40 million individuals have untreated hearing loss. We know that treatment is often delayed until communication is severely affected. So people are doing something, but it's not until it's really starting to impact their lives. And on average, we know that hearing aid users wait anywhere from 7 to 10 years after their initial diagnosis before being fit with their first set of hearing aids. So the question then becomes, well, why on earth are we waiting to treat hearing loss? Why are we waiting so long? And I have a slide that kind of sums up one of the bigger reasons. It's not denial. I'm just very selective about the reality I choose to accept. So denial is a big one. One of the biggest reasons we wait to treat hearing loss is because we're either unaware or unwilling to acknowledge that there is a loss and to acknowledge that it is also a problem. I know for my patients, I hear a lot of, I hear what I want to hear, or everyone needs to speak up and stop mumbling. And when I hear that, again, it's someone deflecting the problem onto someone else, or a complete lack of acceptance to acknowledge that there is something going on, and again, that it is a problem. So what's another reason we wait to treat hearing loss? Stigma. A lot of people still feel that there's a stigma attached to hearing aids. They make you look older, or maybe they're a sign of weakness, and a lot of people use that as a reason to avoid getting help. Vanity. I don't want that big, bulky device on my ear. We're fortunate that technology has come very far, and most hearing aids today are practically invisible. But some people still have that perception that hearing aids are big, they're bulky, and I don't want it on my ear, and if it is on there, I don't want anyone to see it. So vanity is certainly an issue that's keeping people from getting the help that they need. Finances is another one. We know that hearing aids are very costly, and unfortunately most insurances do not help cover the cost of the devices. So that is yet another reason that's standing in people's way of getting the help they need and deserve. Okay, so why should I treat my hearing loss? What are the reasons that I should actually do something? And the biggest reason is really to stay connected to the world around you, to improve the relationships you have with your friends and family, to be able to hear environmental sounds that are crucial for your safety and balance, to improve your physical, cognitive, and social well-being, which will ultimately improve your quality of life. Those are huge reasons to go out and do something about your hearing. Well, what happens if I ignore my hearing loss? Research shows that there are detrimental effects to your overall well-being, including your physical, cognitive, and social wellness, and that's what I'm going to be touching on next. Let's start by talking about your physical well-being. How are we at risk physically with untreated hearing loss? And one of the ways is that you're going to be more susceptible to experience fatigue. When you have a hearing loss, the brain is working overtime trying to put together a message. And what most of us don't realize is that simple conversation relies on brain activity from many areas. We use the brain for speech production, comprehension, hearing, and vision during a simple conversation. So when you have a hearing loss, it means all of those areas have to work so much harder because one of them is damaged. They're all trying to work harder to compensate for that loss. And that means a hard of hearing person has to think, concentrate, and work much harder to hear. And that can cause fatigue. How do I know if I'm fatigued? What are the signs? What are the symptoms? You could start to feel tired or exhausted. You could find that you have a lack of energy throughout the day. You could experience a decline in focus and concentration. You may be less able to monitor your own self-care, be more prone to depression. You also may be less productive and more prone to accidents. What's another one of the physical risks of untreated hearing loss? Balance and falls is a big one. Johns Hopkins did a study and they found that people with even a mild hearing loss were almost 3 times more likely to have a history of falling than those with no hearing loss. And as the loss progressed, as it became worse, your risk for falling actually increased. In fact, for every additional 10 decibels of hearing loss, it meant that your risk of falling increased by 1.4 times. They speculated as to why this is. Why are we more at risk for falls if we have hearing loss? And they really felt in the study that it was due to a lack of awareness of your surroundings. When you have a hearing loss, you're not going to be able to be as in tune to your environment, and they felt that was the biggest reason people were more susceptible to falling. They also speculated that the brain, again, may be overwhelmed by demands of the hearing loss, and in turn not respond adequately in other areas. What's another physical risk factor? Hospitalization and illness. Researchers analyzed data from more than 1,100 American men and women, age 70 and older, with hearing loss. In over a 4-year period, they found that hard of hearing individuals were 32% more likely to have been admitted to the hospital than over 500 adults with normal hearing. In addition, they were 36% more likely to have prolonged stretches of illness or injury, and 57% more likely to have extended episodes of stress, depression, or bad mood. And that was taken from the Journal of the American Medical Association in 2013. So this is not to say if you leave your hearing loss untreated, you're going to fall or you're going to wind up ill or in the hospital. But what it is saying is that your risk for experiencing those things certainly increases with untreated loss. What's another physical risk of untreated loss? Stress. Hard of hearing individuals have been reporting higher levels of stress for many years. And we know that experiencing stress can lead to an array of problems in the body. It can cause increased muscle tension, headaches, increased blood pressure, increased tinnitus, and difficulty sleeping. Another physical risk factor is tinnitus. For those of you who are unfamiliar, tinnitus is the perception of sound in the ear when no sound is actually present. And it often accompanies hearing loss. And what we know based on research is that hearing loss that's left untreated often results in the tinnitus becoming more bothersome. It can actually become louder and more chronic. And that inevitably can affect your ability to sleep and can also start to interfere with your ability to hear and to understand others. So to sum up the physical effects of untreated hearing loss, we know that by not doing anything to treat the loss, you can experience more fatigue, you can experience more balance problems and be more likely to fall. You're at an increased risk for hospitalization and illness. You're at an increased risk for higher levels of stress, which can lead to a variety of problems within the body. And you're also at an increased risk to develop tinnitus or have the tinnitus progress or become louder. So what are some of the cognitive effects of untreated hearing loss? We've covered a lot of the physical ones. Well, how about within the brain, what's happening to us with untreated loss? Before we get too into this area, it's really important to understand how we hear. We don't actually hear with our ear. We hear with our brain. Sounds are transmitted from the ear to the hearing nerve and actually processed at the level of the brain. And it's in the brain that we actually comprehend and understand what's being said. So when you have a hearing loss, what's happening at the level of the brain? We know that a hearing loss causes inadequate stimulation of specific regions within the brain. And that lack of stimulation causes those structures to atrophy. They get smaller and they get weaker. And inevitably, your ability to process and recognize speech and other sounds is compromised. So as those areas become weaker and smaller, your perception may be that speech becomes more garbled, more muffled. You start to really lack a sense of clarity when you're listening to others. And one of the greatest reasons for this is because the brain truly cannot remember how to distinguish between the different speech sounds. So your ability to distinguish between an S and a T or a P and a B starts to diminish. And that is what causes speech to sound more garbled and more muffled. And that's what causes that lack of clarity. So we know that there are these changes happening in the brain, that if we don't stimulate these areas, they're going to get weaker, smaller, and inevitably it will affect our ability to hear clearly. So the question most people then have is, well, if I get on board with hearing aids, can we regrow these areas? Can we improve on that ability? And in large part, the answer is no. Once you lose those areas, it's very hard to get them back, and for the most part, they are gone. Newer research coming out is suggesting that there is some regrowth after stimulation is introduced, like hearing aids. But what we also know is that the recovery process is never complete. So you may get some of it back with the hearing devices, but we know we're never going to be able to get back the bulk of what you lost. So there's obviously major changes in the brain when you have untreated loss, but how am I going to feel it? How will I be affected in day-to-day situations? We know that you may develop difficulty processing speech in the presence of noise. You could have more difficulty processing rapid speech. You're going to could experience a loss of brain tissue and cognitive decline and dementia. And in these areas, I'm going to go into a little bit more detail. So by not stimulating the brain, your ability to process speech will be compromised. When you have normal hearing, our brain naturally filters out what we want to hear from what we don't want to hear. So your brain has this wonderful ability to try to focus in on speech, and it attempts to really ignore the unimportant information like background sound. Well, when you have a hearing loss, there's a lot of disruption in this filtering system. In fact, it's really wiped out. So your brain can no longer discriminate between speech and noise. And again, things start to sound more garbled, less clear. And it's much more challenging to focus in real noisy environments. In addition to having problems hearing and noise, your ability to process rapid speech is going to be diminished. When you have a damaged hearing system, the brain will start to process sounds more slowly. And there will be an inability for your brain to really keep up with speech and incoming auditory information. So again, in terms of speech processing, your ability to hear in noise as well as your ability to process rapid speech will be compromised as the hearing loss goes untreated. What else is going to happen? At the level of the brain, there's going to be a loss of tissue. Johns Hopkins did a study with Dr. Lynn, and for those, again, who are not familiar, Dr. Lynn has really become the guru in the area of looking at cognitive decline and hearing loss. So if you're interested in learning more about this area, I would really encourage you to look at some of his studies. He's done some great things, really found some he's really found some very interesting things out. So at Johns Hopkins with Dr. Lynn, they did the Baltimore longitudinal study of aging, and they started this study in 1958. And what they did is they trained women, and in 1994 they actually started doing MRIs on about 126 participants, some of which had hearing loss and some of which had normal hearing. So they were looking at MRI scans to see how the brain changed if you had hearing loss. And what they found was that those with hearing loss had accelerated rates of brain atrophy as compared to those with normal hearing. Those with hearing loss actually lost more than an additional cubic centimeter of brain tissue each year as compared to those with normal hearing. That's huge. In addition, they found significantly more shrinkage in brain structures responsible for processing sound and speech, which makes sense. If we have a hearing loss and those areas of the brain are the ones that are most deprived, then of course we're probably going to start to lose those areas first. So this, again, proves that there's an actual change in the structure of the brain. There's an actual loss of tissue. And this is really a schematic of the different areas that are involved in hearing and speech understanding. Sometimes we think when we have hearing loss, it's just one part of the brain that's affected. It's just one part of the brain that's deprived, no big deal. When you look at this image, you can see there are gross areas of the brain involved for hearing and speech understanding. And again, these are the areas that are affected as you have untreated loss. So why this major loss of brain tissue? And again, as I stated before, it's not as simple as just one region being affected. There are many regions that are affected, including areas that play roles in memory and sensory integration. And when those areas are affected, it can cause anywhere from a mild cognitive impairment all the way up to Alzheimer's disease. So at the end of the study, they really concluded that the results suggested that hearing loss was a hit on the brain in many ways. And again, this is just another image that illustrates the right and left brain and shows the different areas that are affected on both sides. So there was another study done at the University of Pennsylvania that looked at brain activity when listening to complex sentences. So again, trying to see how the brain was performing when you had hearing loss. And what they found was that people with hearing loss showed less brain activity on MRI scans. Poor hearers also had less gray matter in the auditory cortex, suggesting that areas of the brain related to auditory processing may show accelerated atrophy when hearing ability declines. So they were highlighting the fact, very similar to Dr. Lynn's study, that one, there is a true loss of tissue in the brain when you have hearing loss. And this is most likely the result of the lack of activity, the lack of stimulation within the brain. In addition, the areas that we use to hear and understand speech are the first affected and the most affected because those are the areas that are used for speech understanding and hearing. Those are the areas that are really deprived. Dementia. Johns Hopkins, again, did another study with Dr. Lynn. And what they did is they looked at individuals aged 36 to 90 without dementia. And those individuals had different degrees of hearing loss, anywhere from mild, moderate, to severe. And they followed up with these patients at a midpoint of almost 12 years. And what they found was that at that point, 58 of the individuals were then diagnosed with dementia, including 37 who had Alzheimer's disease. And they concluded that the risk of dementia was actually increased among those with even a mild hearing loss. Further increases in risk were observed among those with a moderate to severe loss as compared to those with mild. So in other words, as the loss progressed, your risk for developing dementia was increased. For every 10 decibels of hearing loss, the extra risk actually increased by 20%. For participants aged 60 and older, 36% of the risk of dementia was associated with hearing loss. So they found a huge correlation between dementia and hearing loss within this study. And this was an image, this is just an image of a healthy brain versus one with advanced Alzheimer's disease. So you can see there are gross changes in the brain as we start to experience cognitive decline. And this is just another set of images of a normal brain, one with more mild cognitive impairment, and another one with Alzheimer's disease. This was such a significant finding that they wanted to do a second independent study to really confirm whether or not this was accurate. So Dr. Lynn did another study, this time with almost 2,000 individuals as opposed to 600. So they wanted to go with a much larger sample size to, again, make sure that what they were finding was in fact accurate. They started this study in 1997, and what they did find was something very inevitably really the same thing. People who suffer from hearing loss would typically experience a loss of memory and thinking capabilities 40% faster than those who had no hearing problems. So that study just confirmed the findings within the first study. So what's the link? I'm not here to tell you that hearing loss, untreated hearing loss is going to cause dementia. What we do know is that the two are very much correlated, but there is uncertainty as to why hearing loss increases the risk of getting dementia. At the end of these studies, they threw out some theories as to what the link is, and one of them being, again, this cognitive overload. They speculated that the brain is actually tiring itself out because it has to overcompensate to hear things, so other areas are being deprived, such as the areas that are really important for memory or sensory integration, and that was then leading to the cognitive decline. Another thing that they had speculated was that hearing loss a lot of times will cause isolation, and that is a social risk factor as well for dementia, so they felt possibly there was a link there. That could actually contribute itself to the decline of mental faculties. The good news is that they're still researching very heavily in this area, and we're hoping that down the line we'll get even more answers and ideas as to what that link really is. To sum up the cognitive effects, we know, again, that hearing loss can cause the brain to process speech sounds inaccurately, which will lead to increased difficulty hearing in noise and increased difficulty processing rapid speech. We also know there's a loss of brain tissue in areas involved in speech and hearing when you have untreated hearing loss. Hearing loss can also increase the rate of cognitive decline and dementia in adults. So really those are the major risk factors cognitively with untreated hearing loss. Let's talk about some of the social effects of untreated hearing loss. The bulk of the first part of this is going to be taken from a study that was done by the National Council on Aging, and what they did is they surveyed over 2,300 hearing impaired adults aged 50 and over, and what they found was that those with untreated hearing loss were more likely to report depression, anxiety, and paranoia. In addition, they were less likely to participate in organized social activities as compared to those who wore hearing aids. They felt this study really debunked this myth that untreated hearing loss in older persons is a harmless condition. In fact, it was really anything but. So sadness and depression, this is a big one. This is a big social risk when you start to develop hearing loss and you leave it untreated. Within this study, they found that more of the seniors with untreated hearing loss reported feelings of sadness or depression that lasted 2 or more weeks during the previous years. In addition, 30% of the respondents with more severe hearing loss and non-users of hearing aids reported these types of sad feelings, whereas only 22% of the hearing aid users did. So within their study, they found that if you were to seek treatment by wearing hearing aids, you were certainly less likely to experience those feelings of sadness and depression. So research indicates that as health problems increase, the risk of depression increases. So what we know is that as you leave hearing loss untreated, it will get worse. And as it gets worse, you are more likely then to experience depression. Hearing loss can cause a significant impact on communication and creates a sense of loss. And that sense of loss causes you to start to really develop negative feelings about yourself. You may start to feel anger, fear, guilt. You may start to feel incompetent, unworthy. These are real feelings that individuals with hearing loss can begin to experience. And those types of negative feelings about yourself may begin to lead to isolation. Many people report that hearing loss has created a solitary confinement for them. And again, a lot of it has to do with the way they're feeling about themselves. They feel inadequate or awkward or embarrassed or just different. And when you're not feeling good about yourself, it really leads to a lack of desire to socialize. And as you start to stay more to yourself, it will inevitably affect the relationships you have with other people. It's going to probably hurt the relationships you have with your spouse, your children, your grandchildren, your friends, your colleagues. In this study, they found that 42% of hearing aid users were participating very regularly in social activities, whereas only 32% of non-users were. So again, there was certainly an improvement or an increased likelihood that you would participate and be more social if you were to treat the loss with hearing devices. Paranoia was another thing that they looked at. They felt that individuals not treating their loss were more likely to experience paranoia. And what they classified as paranoia was this feeling that other people get angry at me, or other people are bothered or irritated by me. And this was kind of interesting because it was the biggest separation between those who treated the loss and those who did not. But 36% of those with untreated hearing loss had this perception that they were actually bothering other people, that they were making other people angry, whereas only 14% of those that wore hearing aids felt that way. So there was certainly an improvement in that person's perception and self-confidence when they started to wear hearing aids. What are the other social risks for untreated hearing loss? Well, it can certainly put a strain on your relationship and your marriage. A research study was done by hearingdirect.com, and they polled 1,000 respondents with hearing loss. And what they found was that hearing loss could lead to more arguments between couples and actually cause a breakdown in marriages. And for those health providers out there, I think we've all been in that boat where we've seen it firsthand. We've seen that loss firsthand get in the way of people communicating and having healthy relationships. According to the study, many of the hard of hearing individuals felt upset that the spouse wasn't able to empathize on how that condition affected their daily life. And that misunderstanding was actually causing them to become more isolated from their family, friends, and colleagues. So there truly was this disconnect for a lot of these individuals in the study. Out of the 1,000 participants, 1/3 said their inability to hear properly had caused major arguments within the marriage or within the family. And approximately 1/16 revealed that their partner had threatened to leave or divorce them unless they sought help. So major things, major disagreements going on within the marriage when you leave a hearing loss untreated. What's another social risk? Decreased earning potential. The Better Hearing Institute conducted a study on the impact of untreated hearing loss on household income. And what they found is that it directly affects income potential. In fact, hearing loss negatively impacts household income on average of up to $12,000 per year. But if you were to wear hearing devices, it could mitigate that effect by 50%. Well, I think that's a reason right there to run out and get hearing aids, to run out and get help. That was a huge finding, and that research has actually been around for quite some time. At the end of the study, they looked at reasons for this loss in compensation, and they speculated that it could be due to underemployment, individuals with hearing loss making more mistakes on the job, most likely due to a lack of awareness of their surroundings. and also possibly a reduced quality of life by that hard of hearing individual. We know that if you're not feeling real good about yourself, if you're not feeling confident, you're probably not going to be performing at your best in terms of your work. What's another social risk factor? A loss of independence. An inability to hear speech and environmental sounds may leave you relying on others to help you through life. And I see this quite a bit with my patients. Typically when I see seniors come in with their kids or close family members, the question of driving comes up. Is it safe for you to drive if you have a hearing loss that's going untreated? And the reason people ask that question is because they want to know if you can hear the blinker in your car. Can you hear horns and sirens on the road? Are you able to respond appropriately when rescue vehicles are coming up behind you? Are you aware of traffic and different things going on around you? We all know that when you have hearing loss, the world around you, you're not as tuned into the world around you. So is driving really safe? Is that really what you should be doing? Living alone. Again, is it appropriate if you're hearing impaired and you're not doing anything about it? And family members are often very concerned about this as well. Can you hear the doorbell? Can you hear someone knocking on the door? Are you able to hear alarms or different signals in the house? Can you hear the telephone ring? And if you do hear the telephone ring, can you hear me clearly through the phone? So again, you don't want to ignore your loss and put your own independence at risk. I know that my patients find being independent and doing for themselves to be one of the greatest gifts they have. So to lose that is devastating. Okay, to sum up social effects, we know that untreated hearing loss can increase your risk for sadness and depression. It can cause isolation and paranoia. It can put great strain on your relationships and your marriage. It can cause decreased earning potential and also a loss of independence. Okay, so there's all these things that happen, or all these risk factors involved when you're not treating your loss. So the question then becomes, what can I do to avoid putting myself at risk? What can I do to try to prevent this from happening? And the number one thing I tell my patients is really to preserve your hearing. 90% of the time we know that hearing loss is permanent and you can't restore it once it's gone. But what you can do is try to protect it. I would encourage you to avoid loud sounds. If you have noisy hobbies, if you love your loud music or gunfire, if you like concerts, if you're into hunting, if you need to be in those environments or you really enjoy them, make sure you wear the appropriate hearing protection. Another thing I talk about is to make sure you're keeping your music at safe levels. Our youth today is so into playing their music so loud and drowning the world out around them. And what they're probably not realizing is that they're putting themselves in harm's way and leaving themselves more likely to develop hearing loss. So if you want to preserve your hearing, you really first need to start by protecting it. What are the other things that you can do to avoid putting yourself at risk? You can be proactive. Have your annual hearing evaluations. Most insurances will pay for an annual hearing test. And even if you're not sure if you have hearing loss or if you're not sure if it's that bad, go get a baseline test. It's important for us to figure out where you're at so that we can track and monitor the loss to determine the rate of decline. The other thing I really encourage you to do in terms of being proactive is to be open with your friends and family. The majority of the time, the friends and family are the first to notice the hearing loss. It's not the person with the loss, it's usually the people around them. And I would encourage you to discuss this with the person, to bring it up to them. One, they may not even realize it's happening. So you may be bringing something to their attention that they're not aware of. And two, if they are aware that they have hearing loss and they're trying to hide it, you need to bring it to their attention so they understand that it is apparent and that it is affecting your ability to communicate with them. And always I encourage you to do this, but do it from a place of compassion. It's a very sensitive topic to talk about someone's hearing, and make sure if you do decide to address it with a friend or a family member, you're coming from a place of compassion. What's another thing that you can do to avoid putting yourself at risk? Seek treatment. Don't delay. We know that hearing devices stimulate the brain. and the system works on a use it or lose it basis. So if you avoid treatment, it's going to cause parts of the ear and the brain to deteriorate at a more rapid rate. And we know that hearing loss is more difficult to treat as it becomes worse. And again, as you lose those areas of the brain to hear and understand, hearing aids can't necessarily regrow those areas back. So the important part is to get stimulated sooner, to try to protect and preserve those areas to the best of your ability. The other thing to remember is that hearing aids improve your overall quality of life. I think sometimes we get caught up in hearing about all the negative things about hearing aids, and we forget that at the end of the day, the vast majority of individuals feel their hearing aids are improving their life, are benefiting in a great way from them. And one of my favorite charts that illustrates that is this one here, Benefits of Treatment per the National Council of Aging Study. What they did is they asked individuals who recently got hearing aids to rate their level of improvement in a bunch of different areas. And as they went through and rated them, there were significant improvements in all the areas, in their relations at home, their feelings about themselves, their overall life. All of those areas improved by almost 50%, if not more. In addition, their mental health, self-confidence, safety, all of these areas these individuals felt had really improved. One of the other things I love about this study was that it wasn't only the person that got the hearing aids that noticed the improvement, it was the family members as well. When the family members were asked to rate the level of improvement after their family member got hearing aids, their responses were even greater in terms of the improvement noticed. And that's huge. It's important to remember that it's not just the person with the hearing loss that's affected by the loss. It's a family issue, and it will affect communication with many people. So it's good to remember that not only will you be helped by treating your loss, but your family members will appreciate it as well. And it was clearly displayed in this study. Again, their responses were even better than the person with the hearing aids. So in addition to getting treatment and not delaying treatment by wearing hearing aids, another way to really avoid putting yourself at risk is to seek treatment through auditory training. In addition to hearing aids, auditory training is great in that it helps you develop skills and strategies to listen and communicate. It's really an additive to the aids. Studies show that you can retrain the brain on speech comprehension, and it can improve your ability to hear and understand by up to 40%. It can actually improve your ability to hear in challenging listening situations as well, like noisy environments, hearing rapid speakers or competing speakers. And I wanted just to highlight a couple of the more popular programs. LACE is probably the most popular auditory training program. It stands for Listening and Communication Enhancement. And what it is it's an at-home training session that you can do on your computer, and it's made up of 20 to 30-minute listening exercises, and it actually progresses in difficulty as you go along. You can complete the program in 10 days, or you can extend it if you wish. I really recommend making it a routine part of your life. When you do auditory training, it's something that you really can do forever to try to continue to improve your ability to hear clearly. And again, it's something that you can purchase off the internet, download to your computer. They can also send you a disc that you can put into the computer or even your TV. And then sometimes your audiologist may have it for you to work on at their office, or you can purchase it from them. Another real popular program in terms of auditory training is Read My Quips. In this particular program, you listen to the witty saying and you type in what it is you think you heard. And you're doing this in the presence of competing noise. And as you go through the program, the noise levels actually increase. And so you're really training your brain on how to hear and focus in the presence of extra noise. So it's another great program that is just, yet again, in addition to the hearing aids, can really bring you full circle and improve your ability to hear and communicate. Last but certainly not least, I really encourage you to stay connected. Get involved with groups that can offer guidance and information about hearing loss and the process. And Of all the groups, I would really recommend the Hearing Loss Association of America. They offer advocacy, education, and support. There are many local chapters that you can reach out to that have expert speakers, peer mentors, and just offer a lot of education and guidance to help you manage your hearing loss. As I stated earlier, I'm on the board of the Hearing Loss Association of America Sarasota Manatee chapter, and we do have monthly meetings. In addition, we have meetings every other month in the evening to help accommodate those that are working. But again, there are many local chapters out there, and I would encourage you to get involved and stay connected to your peers. In conclusion, we know that untreated hearing loss can negatively impact your physical, cognitive, and social well-being. And in order for you to preserve brain function and improve your overall quality of life, it's imperative that individuals seek treatment for their hearing loss.
Thank you so much, Lyndsey. So much good information and very comprehensive presentation. We do have several questions. The first being, is it possible to get a copy of the PowerPoint? And I've answered yes in the text box. We will post that along with the MP4 replay, and I provided the link there in the chat box. Joanna asks, Dr. Nalu, are you aware of any research on young 20 to 40-year-old military veterans in relation to hearing loss? Are you aware of any research on young military veterans in relation to hearing loss?
What I am aware of in terms of the veterans is obviously excessive noise exposure is going to contribute to hearing loss, but one of the things I've been finding more recently is that a lot of times that loss won't show up initially. It actually has been shown to damage a lot of structures within the ear, but not necessarily show up yet on an audiogram.
Okay, there was some talk about Dr. Lynn, and I wanted to point out to everybody that Dr. Lynn is on the HLAA board, and I am pleased that he will moderate the research symposium at convention 2016, which will be here in Washington, D.C. So just wanted to throw a little additional information in there as well. Deb asks, you make a connection between hearing loss and Alzheimer's, but it is my understanding that Alzheimer's is caused by plaque and not atrophy due to loss of use. Could you clarify, please?
Again, what the research that I have reviewed is suggesting is that there is certainly a link or a correlation between a lack of stimulation in those areas of the brain and dementia. I can't really speak well to the idea of plaque development as the cause for dementia, so I don't know that I can fully answer that question. But certainly within the most recent research I have reviewed, it was suggesting that hearing loss was playing a role.
You mentioned that hearing loss causes atrophy in the brain that is not fully recoverable. But I know several people who are late deafened and had no hearing for several decades before getting cochlear implants. They have all regained their ability to hear and process speech. Why is that?
Again, you can recover the ability to hear and understand, but the recovery will never be fully complete. Once you deprive those areas, it's not to say that you can't stimulate and try to regrow those different areas. It will take work and it will take time, but will it ever be the way it could have been had you avoided the lack of stimulation? No, it will not.
The authors of the study you referred to on hospitalizations.
I do not have that in front of me, but I can certainly make I can make that available. Nancy, I can get that information back to you. That was in regard to the hospitalization study.
Okay.
Okay. That was in the Journal of the American Medical Association. I'm sorry, that was within the Journal of the American Medical Association. But I don't. Yeah, you're right. I did not list the actual authors. I can look into that.
The next question, Deb again says, does Dr. Nalu inform her patients of adaptive equipment and visual alerting devices for the home?
Yes, I do.
Is there a
I'm
charge
familiar with
for
a lot of the alerting
equip?
equipment and the different devices out there. Yes, I do. Yes, there is a charge. And I saw someone posting something about Angel Sound. Angel Sound is actually a free online program that you can tag into, and there's no charge. So if you're looking to do auditory training without having to pay for anything, that would be something to look into. It's called Angel Sound.
Katie, do the cognitive effects, other than the dementia, manifest in children who experience a postlingual hearing loss? Not sure.
I'm not quite sure on that. To be very honest, I haven't done a lot of research in the pediatric area, so I wish I could
several
answer
comments.
that question.
It was a great presentation, so thank you, Lyndsey. Let's see, one more question here. Are you aware of any studies on sudden hearing loss in one ear, its cause, and impact on cognitive functions?
That is, it's a great question, and I wish I was, but I'm not familiar with recent research on sudden hearing loss.
Do culturally deaf people have more dementia?
And how it will affect cognitive decline. I'm not, these are great questions.
I haven't heard of a study on that either, but interesting question.
I don't know.
Okay, I think we're at the end of questions, unless anybody has another quick one for Lyndsey. Let's see. Pocket talkers and other assistive listening devices seem more effective in some noisy situations than hearing aids. Would using those have as much positive effect as using hearing aids?
Typically, an assistive listening device like that, where you can, I know certain devices you can actually put the microphone, the transmitter, close to the person's mouth and have it come directly to you. So when you start to eliminate really distance, background noise, that type of thing from that type of assistive listening device, it can certainly improve clarity. I would just caution you to make sure that when you're using that type of technology that you are using something where the output is controlled so that you don't risk over-amplification and further damage to your hearing. But yes, that type of device can certainly be helpful in that type of situation.
This is a very hot
even
topic,
more so than a hearing aid.
And perhaps, Lyndsey, we can ask you to present at convention. We're in St. Louis for Convention 2015, or possibly in 16 when we're a little closer to your home. But this was so informative, and let's see, there's one more question. American Sign Language has been shown to stimulate some of the areas of the brain as auditory input in culturally deaf individuals who use sign to communicate. So I guess not really a question, but a comment from Jordan. Thank you. Okay, I guess we'll wrap things up for tonight. Again, Lyndsey, thank you so much for presenting. We really appreciate it. Such great information. Again, this has been recorded and we'll post on our website. Usually takes us about a week or so to do that. We've been a little behind in posting, but we're working very quickly to get caught up and get posted very soon following the webinar. So thank you very much, everybody, for attending tonight, and we'll see you next month. Thanks again, Lyndsey. Good night.
Thank you all so much. Yep, my pleasure. Good night.
Thank you, Deanna.